21st, 2026. I am your automated host, Zara, speaking for Marketstrat. This week, our team is tracking a fundamental shift in the healthcare technology market archetype. We are officially exiting the era of one-time regulatory permissions. In our analysis, competitive advantage is moving ruthlessly toward continuous operating proof. For healthcare executives and investors, the message is clear. A regulatory clearance or a signed contract is merely a starting gate. Durable value concentrates only when you can convert access into activated workflow, measure real-world performance, and demonstrate true economic retention. Let's begin with the clearest end-to-end proof of operating conversion we have recorded this week.
We are analyzing Pro Medicus's newly released full-year 2026 financial results. Their revenue reached $261.7 million Australian dollars, with an underlying EBIT margin expanding to an extraordinary 74.9%.
But our Marketstrat POV is that the financial margins are just the trailing indicator. The real story lies in their execution telemetry. They completed 16 go-lives and renewed 6 out of 6 expiring contracts for 5-year terms. Crucially, all 6 renewals, including major institutions like Northwestern Medicine, MedStar Health, and Allegheny Health Network, were executed at higher per-transaction fees. With 1.34 billion Australian dollars in 5-year forward contracts, Pro Medicus is showing the market what a fully activated, transaction-priced operating platform looks like when it scales. Backlogs are converting directly into routine, high-margin utilization. This demand for continuous performance is now catching the eye of federal regulators. The FDA just released an exploratory discussion paper on regulating generative AI-enabled medical devices. The agency is proposing a 2-axis risk framework that combines non-clinical benchmarking with clinical confirmation, followed by post-market lifecycle monitoring. For developers and platforms, this is a major regulatory signal. In our analysis, performance telemetry must now be treated as a core product capability. The FDA is signaling that static, one-time clearances are insufficient for dynamic AI models. Enterprise imaging platforms that already control the clinical workspace are structurally best positioned to capture this required lifecycle data. But why is the FDA pushing so hard for post-market evidence? Because the baseline data remains alarmingly thin. We are tracking a sobering peer-reviewed evidence census of over 1,300 cleared clinical AI devices. Out of 1,357 cleared tools, the study found that only 34 were linked to registered prospective trials, and only 3 evaluated actual patient-centered outcomes, like mortality or readmissions. This is where Radiobotics is trying to bridge the gap. They just published a multi-reader study of 1,500 consecutive fracture cases across 3 European hospitals, demonstrating that their AI increased overall reader sensitivity by over 10 percentage points. Yet, our data shows why local validation remains mandatory. Even with this strong multi-center data, reader sensitivity for hand and wrist fractures still varied from 75% at one hospital to 91 and 94% at the others. It is proof that you cannot mechanically apply a pooled trial result to your local clinical workflow. Now, let's look at a completely new category of image-guided procedural capacity. The FDA just granted a de novo authorization to Vitestro's Aletta, the first fully autonomous robotic blood drawing system approved for adult outpatient settings. Guided by near-infrared imaging and Doppler ultrasound to identify appropriate veins, the system automates the entire phlebotomy pathway under the supervision of a trained technician. Our Marketstrat POV is that Aletta represents a fascinating test of labor substitution economics. The FDA-authorized protocol allows one supervisor to oversee up to 3 devices simultaneously. If Vitestro can prove high completion rates and low supervisor intervention in real-world clinics, This imaging-guided robot becomes an immediate capacity multiplier for high-volume diagnostic labs. Finally, we must remember that deploying software at scale carries a continuous maintenance and reliability burden. We tracked Class 2 recall postings this week for both MergePax and Philips Incisive CT software. The issues ranged from viewer measurement inaccuracies in Merge to failures to trigger CT scans during bolus tracking in Philips. In our analysis, these events are a stark reminder that installed clinical software creates an active, post-purchase obligation. Providers must negotiate strict service-level agreements that explicitly define responsibility, fallback workflows, and rapid remediation credits for post-market software defects. What is the Marketstrat bottom line this week? Stop underwriting healthcare technology on permission alone. Whether you are buying an enterprise platform, an AI model, or an autonomous robot, you must measure the conversion. Track your investments from authorized access to active utilization to verified economic capture. That is your Pulse Insights briefing for this week. I am your automated host, Zara, narrating Marketstrat. Keep your focus on the operational workflow, and we will see you next time.